last May, I found that I was having pain in my left hip to the point where I couldn't even sit down. I couldn't tolerate that because it was painful. And also when I would play tennis, which I was used to doing, I couldn't do that either because of the pain. And I'd kind of had a little hint of that all going along for years, but I could always just kind of ignore it. But as it got worse and worse, it really did start affecting what I could do. And I was always able to go and do things like Orange Theory Fitness, spinning classes, things like that. I like things that were challenging and kind of really got your endorphins going. And so all of a sudden I couldn't do that, and which was really discouraging to me. And I realized how much that was a part of my life, physically, but as well as mentally. I saw a orthopedic surgeon, and he did x-rays, and he confirmed there was something wrong there, and it was scoliosis that had progressed. Then it had gotten to the point where something had to change, and he said, surgery is really not an option. So there was no quick fix to be had, and he recommended physical therapy. So I went to my Dr. McCall, who is a family practice practitioner, and he recommended Simply Physio. Hi, I'm Cindy Carroll, and I am 52 years old, and I'm a nurse. I'm an RN, and I used to work in an intensive care unit, and then I devoted myself full-time to raising 3 children, and so that's been very rewarding. I'm pretty much an empty nester, and I decided I wanted to go back into my nursing. Years ago, I had an accident, and I had a torn labrum, my shoulder. And so I went to an orthopedic surgeon, and he was saying that, it probably will need surgery, but let's try physical therapy first. So I tried physical therapy and would go 2 to 3 times a week, and had very, very little success with it. So my impression of physical therapy wasn't very positive. It was a room, crowded with a lot of people. I felt like I was on an assembly line. And to be honest, my physical therapist was answering her phone while she was working on me. So I wasn't really, I didn't have any real confidence in that when I was told that I should pursue physical therapy. Mm-hmm. So I was really thankful that I came to Simply Physio, where it was very different, very more personalized, specifically, especially to my scoliosis, which really was the root of the problem. Dr. Chesney pinpointed that, and we instantly started working on things to help with the scoliosis and the impact it was having on my body, and the pain and losing my ability to do the things I loved, and so that was really beneficial. It's a lot more than just physical therapy. And so coming in and being one-on-one and being able to have him assess every specific thing that was going on. And there was a lot of assessment, and it was very thorough. It was not, a quick fix, like, here's medicine, live with this medicine, and and let's just relieve your pain, and you're still going to have the issues though. And so it was a learning experience, definitely, because I'm a nurse and I haven't worked in a while, but I was very much into, the classical kind of treatment where you have surgery, or you take medicine, mm-hmm. and it's fixed, and, you do steroid shots or something, and that's what you live on. And that's what helps you increase your quality of life. Able to do anything I wanted to, and endorphins were my friend, and then all of a sudden I couldn't. And so now I'm able to play tennis, and I'm a lot stronger, and I'm more aware of my body, and how it moves and how it functions. I can identify it, and I know things to strengthen it and correct it. I'm feeling much better. I have a grouping of different specific exercises that I can do if I start to feel a certain pain or a weakness in one place. And so I'm continuing to come in because we're kind of working now on like a wellness set of exercises and everything, and being able to go a little bit further and work on strengthening and things like that. So it's been really beneficial, and I recommend that definitely. And now I'm doing yoga too, and that's really great because that's also strengthening, and and I'm learning what yoga is, because I've never really thought much about yoga being anything more than just a stretching kind of thing, but finding out very differently that it is a lot of strengthening. I came to Simply Physio, and the first time I came, I felt very welcome. And I remember coming in the door and seeing my name on a little chalkboard saying welcome and my name, and I was kind of like, is there another Cindy here? What? And so it really surprised me. It felt very welcoming, and the receptionist was just really sweet, and we would just talk, and it was just a fun thing to come and do. When I've had friends that talk to me about their chronic back pain, or the just like spinal issues and things like that, I've come across a lot of people who have been told that pain medicine is their option, or steroid injections, or surgery, and I try to gently tell people that all of those things are probably not going to be the result that they want long term. Steroid injections long term are not good for your body, and they're just kind of a band-aid on the problem. And so if you want some really long-term treatment, some just holistically for your whole body, then I really recommend coming to Simply Physio, because that's what I've gotten. And I certainly, I would hate to think if I hadn't had that and I still had pain, resorting to pain medicine, because we know just how addictive that is and how awful, we've seen what that does to people's lives, or the steroid injections, which make people feel better. And a lot of doctors and orthopedic professionals will recommend that to you. But once again, it's not going to fix things long term. And there's only so many times you can do a steroid injection. And definitely surgery. As a nurse, I've witnessed what happens to people, how their bodies react to spinal fusions and things like that. And it's not, if you can avoid that, you want to. Yeah. So I would recommend definitely coming to Simply Physio, at least giving it a try. Come for a few sessions and see what you think. And I'm really glad that I came and didn't just stick to the old ideas of physical therapy and what that usually entails. So it's been much more than that, and beneficial.